Welcome to The Explainer. Today, we are going to decode the secret language of the brain. Seriously, we're taking a radiological journey to see how our lives, our choices, and even our treatments can physically sculpt and sometimes scar our most complex organ. So let's dive right in. You know, in a way, it actually does. Think about it. Every major event, from our lifestyle habits to life-saving medical procedures, can leave a visible mark. It's a story written right into the very structure of the brain. Radiologists, they're the ones who learned to read this incredible diary. And today, so are we. All right, first up, let's look at something pretty heavy: the profound impact of chronic alcohol abuse. Now, we often think of the liver taking the hit, but believe me, alcohol can leave some really distinct, readable scars on the brain's delicate architecture. And that leads to some very specific and pretty serious conditions. So, one of those is Marchiafava-Bignami disease. It's a rare but very serious condition, mainly seen in people with chronic alcoholism. What it does is target the corpus callosum. You can think of the corpus callosum as the superhighway for information zipping between the left and right sides of your brain. When that highway gets damaged, well, the signals just can't get across like they should. So how on earth does a doctor even start to suspect this is happening? Well, they look for a specific constellation of symptoms. When a patient shows up with mental confusion, an unsteady walk, maybe seizures, and increasing muscle stiffness, that whole clinical picture starts pointing radiologists right toward this rare diagnosis. And it makes total sense, right? If that information superhighway in your brain is breaking down, complex tasks that need both sides of the brain to talk to each other, like just walking in a coordinated way, they start to fail. And here, right here, is the smoking gun. This is just brilliant. On an MRI taken from the side, radiologists see what they call the sandwich sign. I love that name. It describes how the disease just chews up the central core of the corpus callosum, but, and this is key, it spares the top and bottom layers. So it creates this distinct layered look, literally like a sandwich. It's an absolute telltale sign of this specific kind of damage. Now here's another condition often linked to alcoholism, but this one has a twist. A lot of the time it's triggered by something that happens in a hospital, trying to fix dangerously low sodium levels, but doing it too quickly. That sudden jolt to the body's chemistry can literally strip the protective myelin coating right off the nerve cells. Myelin is like the insulation on an electrical wire. You take that away and the nerve signals just go haywire. And this damage often homes in on a part of the brainstem called the pons. And the neurological fallout from this, it can be absolutely devastating. Patients can suddenly get confused, develop weakness and stiffness in all four limbs, and get a condition called cerebellar palsy, which messes with speech, swallowing, and can cause these unpredictable, wild emotional outbursts. It's a terrifying cascade that can progress incredibly fast. And on the scan, the evidence is just unmistakable. On a specific type of MRI called the T2 weighted image, which is basically designed to make areas of damage light up, the injury shows up as a bright white signal right in the middle of the pons. This characteristic shape, where it spares the outer edges, is the classic radiological signature of osmotic demyelination. It's like a beacon. Okay, next, let's play detective. We're going to look at how different toxins act like molecular vandals, targeting very specific neighborhoods in the brain. The fascinating thing is, they don't just cause random damage all over the place. No, they leave behind a unique signature that can tell a radiologist exactly what poison was involved. Now this is where it gets really interesting. Look at this comparison. Carbon monoxide versus methanol, which you might find in stuff like poorly made moonshine. Carbon monoxide poisoning selectively attacks a part of the brain called the Globus Pallidus. But methanol, it goes for a different spot, the Putamen, and often causes bleeding there too. So you have two different toxins, leaving two completely distinct and identifiable patterns of injury. It's forensic radiology, and it's amazing. You know, it's one of the great paradoxes of modern medicine. Sometimes the very treatments that are designed to save our lives, things like chemotherapy and radiation, can also leave their own lasting mark on the brain. Now, this isn't about placing blame. It's about understanding the full, complex picture of these powerful therapies. This condition is essentially damage to the brain's white matter, the all-important communication pathways. When you look at a scan, the classic appearance is this widespread, symmetrical bright signal deep inside the brain, usually around the fluid-filled spaces called ventricles. Knowing a patient's treatment history is absolutely the key to unlocking this diagnosis. And the brain's response to radiation isn't a single event. It's not like flipping a switch. It actually unfolds over time, in stages.
In the first few months, you might see some changes that are actually reversible. But later on, maybe after 6 months, a more progressive, kind of mosaic-like pattern can emerge. And then, years down the line, the long-term consequences can pop up, including a higher risk for things like strokes or other vascular problems.
So, and this is a really crucial point, radiation is actually recognized as the single most significant risk factor for developing a new primary brain tumor later in life. And there's even a typical timeline for it. More aggressive cancers, they tend to show up within a decade. But the most common type, a meningioma, often appears around the 15-year mark after treatment.
Okay, so we've seen how alcoholism, different toxins, and even our own medical treatments can leave these incredibly distinct fingerprints on the brain. So what does this all mean? What's the takeaway from being able to read these stories, these scars?
Well, it means everything. These images are so much more than just medical data. They're biographical records written in tissue. By interpreting these visual clues, doctors can piece together a patient's hidden history, get a much deeper understanding of their present condition, and, in some cases, even anticipate what the future might hold for them. It's powerful stuff.
And that leaves us with a powerful and maybe even a little bit of a sobering final thought. It's a profound reminder of the incredibly deep and lasting connection between our experiences, our choices, and our own biology. The story of our lives is, quite literally, being written in our brains every single day. Thanks so much for joining me